Christina will give you the definition of HIV.
So HIV stands for Human Immunodeficiency Virus, and it attacks the body's immune system. If it's not treated, it could lead to AIDS. There's no cure, so an infected individual will have it for life. However, it can be controlled and people can live a normal life.
All right, I'm gonna talk a little bit about prevention. The best way to not get AIDS is to not have sex, but you know, this is reality. So using a condom every time, using it correctly, because if you don't, you will get AIDS and you will die.
Yes, sir.
Don't inject drugs, because if you do, you will get AIDS and you will die. But if you're going to, use a clean needle every time.
Okay, so I'm going to talk about the transmission of HIV/AIDS. So HIV/AIDS is not transmitted through casual contacts, but there are 4 known body fluids which is HIV is transmitted. Those are blood, semen, vaginal secretions, and breast milk. So HIV is found also in tears, saliva, and conjunctival secretions, but they're not just linked with transmission. But in urine, stool, vomit, and sweat, HIV is not found. Thank you.
Okay, so you cannot get HIV from the following. You cannot get HIV from the air, from insect bites, from the water. You cannot get HIV if you shake hands with someone, or if you're healthy and you don't have any unbroken skin or any wound. Then there are symptoms that are associated with HIV. So symptoms are like if someone has fever, if you have rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes. There are some high risk factors that are associated with HIV. And as Noah said, it's unprotected vaginal, oral, or anal sex. Then contact with blood and infection body fluids during medical, surgical, or dental nursing procedures. You can actually get HIV from that. Then sharing IV needles and syringes, and transmission from an infected mother to the infant during pregnancy, birth, or breastfeeding. I think that's all.
Any questions?
Any questions?
We don't got no answers.
Don't do drugs.